programming note for Wednesday, which will be tomorrow, we will have as our guest Amy Pope, who you know well. There's the Director General of the International Organization for Migration. She will be briefing you virtually from Haiti, about her visit from Haiti. During her visit in Port-au-Prince, Ms. Pope met with displaced families at a Port-au-Prince site. She also held discussions with Haitian government officials to identify concrete ways to reinforce migration governance, broaden access to legal documentation, and strengthen reintegration. She will tell you a lot more about what she's done when she comes over the airwaves tomorrow. As you know, today marks the second anniversary of the horrific war going on in Sudan, which has created the world's biggest humanitarian and displacement crisis. Over 12 million people have fled their homes, and more than 3.8 million of those have crossed into neighboring countries. More than 30 million people require humanitarian support. Half of the population of Sudan, that's some 25 million human beings, are acutely hungry. And as you well know, famine has been identified in at least 5 locations in the country, and it is projected to spread further. In statements to mark this grim milestone, the Secretary General said the only way to ensure the protection of civilians is to end this senseless conflict, adding that the external support and flows of weapons must end, and those with greatest influence on the parties must use that influence to better the lives of the people in Sudan. And they should not use that influence to perpetuate this disaster. The Secretary General will continue to engage with regional leaders on means to enhance our collective efforts for peace. His personal envoy, Ramtane Lamamra, today is at the London Sudan conference, and he told the participants that he intends to intensify his interactions with interlocutors in Sudan and the broader region. Mr. Lamamra added that urgent political engagement is needed to forestall Sudan's permanent fragmentation, which would have obviously grave consequences for the region and beyond. He reaffirmed our commitment to continue to back all efforts that seek to launch an inclusive and credible political process. And just to give you a bit more information on the tragic humanitarian situation in Sudan, in a statement issued today, our humanitarian and resident coordinator in Sudan, Clementine Nkweta Salami, described the conflict as a crisis of humanity, emphasizing that millions of lives are hanging in the balance. She called for the protection of civilians and aid workers, full respect for international humanitarian law, and of course an immediate end to the violence. Like other conflicts and wars, this one in Sudan has a huge toll that is mainly felt by women and children. Our colleagues at UN Women tell us that there is a 288% increase in demand for life-saving support following rape and sexual violence, with sexual violence and rape being systematically used as a weapon of war in Sudan. UNICEF warns that the number of children in need of humanitarian assistance has doubled from 7.8 million in 2023 to more than 15 million today. Meanwhile, our colleagues at the Office of the Coordination of Humanitarian Affairs remain deeply concerned by ongoing reports of mass displacement, mounting civilian deaths, and continued access restrictions in North Darfur. The International Organization for Migration reports that up to 400,000 people have fled Zamzam camp in recent days, which is obviously due to the escalating insecurity in the camp. Most remain displaced within the locality of El Fasher, while others have sought refuge in the towns of Tawila and Dar es Salaam. As of today, Zamzam camp is inaccessible, and a communications blackout continues to hinder independent verification. Local sources are telling us that armed groups have taken control of the camp and are restricting the movement of those people who have chosen to remain, especially young people. It is difficult, unfortunately, to verify the exact number of casualties due to the insecurity in North Darfur, but I can tell you that in the past 3 days alone, more than 400 people, including 12 humanitarian workers, have reportedly been killed in Zamzam and Kadala in North Darfur. That's what local NGOs are telling us. Among the casualties was the manager of a children's center in Zamzam who died after being injured in shelling. 11 others were killed in an attack on health facilities operated by Relief International. We urge all parties yet again to allow for the safe, unhindered access for aid workers and to meet all of their obligations under international humanitarian law. And just to flag that this morning, Security Council members met in close consultations. They heard from our Special Envoy, Hans Grunberg, and the Director of Operations for Advocacy at OCHA, Edem Wosornu. That was, of course, on Yemen. This afternoon at 3 p.m., they will reconvene in close consultations to hear about the situation in Sudan. Ms. Wosornu will brief again, but this time on Sudan. Turning to the dire situation in Gaza, our humanitarian partners report that ongoing civilian casualties amid the destruction of more infrastructure. This includes today's Israeli strike on the Kuwaiti field hospital in Khan Yunis, which reportedly injured several staff members, including 2 nurses. That's what the local Ministry of Health and local partners are telling us. This comes days after the strike that hit the Al-Hali Arab Hospital in Gaza City. And you will see in the statement from the Secretary General that we issued yesterday afternoon, in which he recalls that under international humanitarian law, the wounded and the sick medical personnel, medical facilities, including hospitals, must be respected and they must be protected. Until Sunday's strike, Al-Ali was the main hospital dealing with casualties from Israeli airstrikes. Now, most casualties are sent to Al-Shifa Hospital in Gaza City. WHO says that only 21 of Gaza's 36 hospitals now remain just partially functioning. Almost all of them have had some damage during this conflict. This latest strikes on hospital further cripples Gaza's healthcare system. Our humanitarian colleagues tell us there are currently very few beds available in hospitals, and patients are being accommodated in tents. Our partners working on health also stress the need for thousands of blood units for life-saving operations. Meanwhile, humanitarian partners say that food commodities in warehouses have reached very low level, given that no aid has been coming into Gaza for weeks now. And finally, to conclude on a slightly positive development, and despite everything going on last week, our humanitarian partners installed a backup generator at Kamal Adwan Hospital to power the water system, producing some 20 metric cubes. What? Cubic. 20 metric. I don't know. 20 cubic meters of clean water per hour. Math is not my strong point. And obviously, you will remember that Gaza has been under an electricity blackout, so people do have to resort to generators. We reiterate that civilians must be respected and protected at all times, and they must have the basic necessities to survive. All hostages must be released immediately and unconditionally, and a ceasefire must be restored and renewed without delay. A quick update from Myanmar, where our colleagues at the UN Refugee Agency tell us that a plane carrying critical relief supplies was able to land in Yangon today. The UNHCR chartered flight left from Dubai earlier today and carried some 40 metric tons of life-saving aid for 16,000 people impacted by the earthquake last month. The flight brought in tents, critically needed, obviously, for families that need shelter, and household items to support quake survivors in Myanmar. To date, UNHCR has distributed most of its in-country stocks to some 50,000 survivors of the quake in Mandalay, Saigon, and Bago regions, as well as Naypyidaw and parts of Shan State. UNHCR has appealed for $16 million to assist 1.2 million affected people as it expands its emergency relief effort, manages displacement sites, and supports vulnerable people in 6 affected regions until the end of this year. Turning to the Democratic Republic of the Congo, the Office for the Coordination of Humanitarian Affairs reports that ongoing clashes in North and South Kivu provinces are continuing to displace civilians and, of course, severely disrupting our humanitarian operations. Our humanitarian colleagues say that fighting in Masisi, Walikale, and Lubero territories last week displaced some 80,000 human beings. Humanitarian operations in these areas have been further restricted due to the continued security constraints. In the past few days, we also mentioned ongoing clashes in South Kivu. We can now tell you that more than 70,000 people have been displaced in Kalehe territory during the first 2 weeks of April, and more than 40,000 people fled Fizi territory between the 27th of March and April 12th. Meanwhile, thousands of people leaving North and South Kivu provinces continue to arrive in Manyema province. Recent assessments by humanitarian partners confirm that 125,000 displaced men, women, and children reached Lubutu and Punya territories between the 19th and the 30th of March alone. These people urgently need shelter, they urgently need food, and they urgently need health care services. We reiterate our call for the safe and unimpeded access for humanitarian workers to reach the people they need to reach. For its part, UNHCR is telling us that severe flooding triggered by torrential rains in recent weeks has displaced almost 10,000 people in Tanganyika province. The Rugumba River burst its banks, inundating large areas of Keleme and Yuzu territory. Stagnant and contaminated floodwaters are, of course, raising concerns of waterborne disease outbreaks, with reported cholera cases in the province already 6 times higher than during the same time last year. UNHCR and humanitarian partners are providing emergency shelter, support, clean water, food, and medical care. However, response efforts are hindered by critical funding gaps, leaving thousands without the aid they urgently need. The agency has received only 20% of the money it needs to carry out its work. And lastly, just in South Sudan, our humanitarian coordinator there, Anita Kiki-Beho, said that she is deeply concerned about the rapid escalation in the country, of the violence in the country. During a visit to Malakal, which is the capital of Upper Nile State, Ms. Beho said that she heard firsthand accounts of the impact of the violence on the men, women, and children who are there. Since March of this year, clashes and bombardments have killed more than 180 people, injured over 250, and displaced some 125,000. 4 humanitarian workers have been killed, while 6 health facilities have been forced to shut down. She called on all concerned to refrain from harming people, including humanitarian personnel, who risk their lives every day for the people they're trying to help. No money, so I will answer your quiz. Edie Letter, please.
Thank you, Steph. You told us what Mr. Lamamra highlights were of his speech at the Sudan conference. Can we get a readout of what the UN believes the conference accomplished or didn't accomplish?
It's still going on, but we will try to get you a wrap-up.
And secondly, in Gaza, are medical evacuations still taking place, or have they been halted as well?
I have not gotten any updates on new medical evacuations. If we get something from WHO, we'll share it with you. Okay? I mean, I'm not going to stand too long.
Well, it's a follow-up on Mr. Lamamra's planned course of action. Did he give any indication? What's his plan for the next months to 3 months for his mediation with the two parties?
He will continue to speak to all sides in this conflict, and of course very much so to the regional partners. And if there's any travel for him that I can confirm, I will do that.
Quick follow-up. Is there any plans for Mr. Lamamra to come to the headquarters anytime?
I will check. I'm not aware, but I will check.
Thank you.
Okay. Evelyn.
Thank you, Stéphane. We're constantly getting emails, I don't know how real they are, from the Trump administration people asking whether the UN has any anti-American policy statements and so forth. Are you receiving this kind of emails?
I am not.
Is there response?
I am not. Okay. Yes, sir.
Hi, thank you, Steph. Kyota Tanaka from Asahi Shimbun, Japanese newspaper. the Washington Post reported yesterday evening that there's an internal memo within the Trump administration where it says that it plans to end the funding for the United Nations, NATO, and 20 other organizations. Are you aware in any way about this government idea, or how would you react to it?
I'm aware of the press articles, which we've read, and I think you will understand if we decide not to comment on a leaked, what appears to be a leaked memo that is part of an internal debate within the U.S. government. On that note, thank you for your active participation today. Stephanie will be here with you tomorrow.